In this video we're going to look at the region booklet for the cervical and head region. So with this booklet, part 1 and 3 have been completed. Part 2 has some parts that need to be fixed up, and parts 4, 5, 6 and 7 still need to be done. So for part 2, you need to identify the origins, insertions and actions of these 3 muscles which were missed. So trapezius, levator scapula and anterior scalenes. For the medial posterior scalenes, you have given the nerve instead of the action. So you need to be able to identify what the actions of the middle and posterior scalenes are. For longissimus capitis and longissimus cervicus, you have missed the action part. For both of these, this needs to be completed. For obliquus capitis inferior, you have given the nerve, but again, I need the action. This is the same for obliquus capitis superior and rectus capitis posterior. For part 4, you need to identify the muscles that are working actively, passively, and with resistive testing. So the scenario is being given and just identify the muscles. So for cervical flexion, active range of movement, the client is seated or standing and actively moves their chin to their chest. Passively, the client is supine and the therapist moves the client's chin to their chest. And resistive test, the client is supine and the therapist resists cervical flexion, so there is no movement. So you've identified muscles in the top part, but you also need to make sure that you're separating what muscles are involved during the active range of movement section and what is being used in the passive range of movement section. Remember, the manual resistive test and active range of movement will be the same muscles, but passive will be different. So this also needs to be done for cervical extension. In AROM, the client is seated or standing and the client actively extends their neck to look at the roof. Passive range of movement, the client is supine and the head is supported off the end of the table to allow the head to fall back into extension, but making sure that you keep the head supported. And manual resistive test, the client is in a prone position and the therapist resists extension of cervical spine, so there is no movement. Cervical rotation, AROM, the client is seated or standing. Ask the client to turn their head to the left and then around to the right. Make sure there is no shoulder movement. PROM, the client is supine and the therapist rotates the head to the left and then around to the right. Resistive test, the client is supine and resist the client's rotating head to the left then to the right, so there is no movement. Cervical lateral flexion, it's an active range of movement. Client is seated or standing and the client moves their left ear towards their left shoulder, brings the head back to neutral, then moves the right ear to the right shoulder. Make sure the shoulders do not elevate to meet the ear. Passive range of movement, the client is supine and the therapist takes the left ear towards the left shoulder and back to neutral, and then the right ear to the right shoulder. Resistive test, the client is supine and resists the client's flexing cervical spine to the left and then to the right, so there is no movement. Part 5 is a special test. So for the following, you need to identify the objective of the test, what a positive finding is, and then how that test is performed. So this needs to be done for the vertebral artery insufficiency test, the cervical compression test, the slump test. For part 6, you need to perform and describe the massage techniques that you would use for the following conditions. So again, region has been given to you, but you need to identify the techniques. So this needs to be done for SCM, a strain in a subacute stage, so SCM being sternocleidomastoid muscle. So that's a contractile tissue. The trapezius, contractile tissue in a strained subacute stage. Levator scapula being strained in a subacute phase, and scalenes, the anterior scalenes, being compressed and looking at the contractile tissue. Part 7, you need to identify what massage techniques, including endangerment zones and contraindications, as well as possible yellow or red flags, the duration that you would be performing treatment on this region or muscle group for, and the depth of your pressure. So the conditions you need to do this for are sternocleidomastoid or SCM strain in the subacute stage for the contractile tissue, the trapezius muscle, contractile tissue with a strain or subacute injury, levator scapula that's been strained in a subacute stage, and suboccipital muscles that have been compressed in the contractile tissue. If you have any questions with this, please chat with Paula or Emily and we can provide further guidance.